I remember wishing that I could just scratch with a cheese grater because the level of pain and intensity was so great. Bouncing back and forth between dermatologists and allergists, for me, there were literally no answers.
When you activate a mast cell, there's a release of chemicals, and these can all lead to chronic spontaneous urticaria.
When something is wrong with your skin, it's the way you face the world.
You can help almost any patient, but you have to be committed to their care.
I'm 50 years old. I live in Cincinnati, Ohio. I completed a nearly 20-year career in federal service and quite a few influences to include my family, the men in my family being veterans. The idea of service has always been extremely important to our family and something that we take seriously. Faith is a very important part of my life. I love to participate in faith-based activities. I love music. My mom used to sing to me, "Good night, my love." I love music from different eras and different types. When this all started, I had no idea what was to come. You're thinking, okay, this is not going away, this is not normal, there's something going on. And I remember thinking maybe it's got something to do with turning 30 and hormone changes, but the tests and the questions, everything came back normal. My organs were normal, my systems were normal, my blood work was normal. And except for this very dramatic, devastating, life-altering manifestation, I was healthy. When I talk about rashes, I'm talking about hot, raised, red welts that make you feel like you're on fire from the inside out. You can't sleep, you can't focus. The level of pain and discomfort is life-altering. It's difficult to have interactions with people. You don't want to go out in public and be seen. You don't want people to think that you're contagious. Your skin is the largest organ in your body, and so when something is wrong with your skin, it's the way you face the world. There's no way to hide it, there's no way to conceal it, and it just literally affects every part of your body to include what you wear, your daily activities, who you do and don't want to see you, and there is just no relief. It is constant. My name is Methi, and I have chronic spontaneous urticaria.
Hives are thought to be a mast cell disease, okay? So mast cells are cells in our body. They're everywhere in our body, and they have a lot of different receptors on their cell surface, and so you can activate mast cells many different ways. And as a result, when you activate a mast cell, there's a release of chemicals called histamine and other chemicals, and these can all lead to inflammation. With chronic spontaneous urticaria, these occur randomly. There is a subset of patients who have what we call chronic inducible hives, and those are triggered by specific stimuli like scratching the skin. For general chronic spontaneous urticaria, this is not something that's thought to be an external trigger.
The level of despair is, on a scale of 1 to 10, it's a 20. You don't understand what's happening to your body. You want to take hold of it and take control of it, but at least initially, there was no cause. Nobody could figure out what was going on. Your life is turned upside down because all of the things that you would normally do, you can't or don't do, from literally clothing that you wear for your physical comfort to your social relationships. There's depression. You sort of feel like you're alone with this battle because part of the mentality is if you can't figure out what's happening, how on earth are you going to stop it? And the other part of that is you start to imagine as time goes on, is this going to be my life? And if this is going to be my life, what does that mean?
Well, itch is a form of pain, and it is very debilitating, and it's not trivial. You can't sleep, you can't function, you can't think. It has so much of an impact on everything you do.
I remember wishing that I could just scratch with a cheese grater because the level of pain and intensity and fire inside was so great. I would take showers just to get the water pressure to help itch my skin.
Women are affected twice as much as men. The onset typically is anywhere from 20 to 30 years of age and out to 50 years of age. It affects up to 1% of the population in the United States.
So there's a lot of trauma associated with this too. Before I got the help that I really needed, you would have maybe a week, maybe two of clear or less severe outbreaks, but it's constantly in your mind about when the next outbreak is going to happen. How long is this going to last? So even when your skin is relatively clear, your mind is always jumping ahead to, okay, where's my next prescription going to come from?
It's an embarrassment if they have welts all over and say, "What's wrong with you?" People think they've got some kind of bad disease or contagious disease, and it's not. So it's, cosmetically a burden too for, especially if you're working in a public environment and so forth.
So in the beginning, I endured literally skin tests, which is kind of poking and pricking. I endured literally a skin biopsy. I had a hive that was on my skin, and a dermatologist literally took tissue to kind of see. There were some kind of uncomfortable tests initially, medications, tons of medications that, did not work. And at that point, in that process, I started to hear, there's nothing wrong with you. And that's a very deep contrast to what was happening. Clearly, something is wrong because this has never happened before. Bouncing back and forth between dermatologists and allergists. The allergists think it's dermatology, the dermatologists think it's, allergy. You start, canvassing family members trying to figure out if anyone else has had similar situations. And for me, there were literally no answers. I will tell you that the experience of this condition, I was living for my family. I was living for my family for a while because you just get to such a level of despair and hopelessness.
A lot of patients feel hopelessness, that there is no help. And that's not true. You can help almost any patient, but you have to take the time and effort to do it, and you have to be committed to their care. So this is a problem where patients are typically passed off from one place to the next, and I don't know what to do here. You go here, and that person says, "Well, I'm not really sure what to go to this doctor," and before you know, you've seen 10 doctors. So this delays the journey. So reassurance is extremely important.
What do I say about Dr. Bernstein? I will never forget the first time I met him. And looking back on it, I wonder how I got through the time before meeting him.
Hello.
One of the things that he said to me during that first appointment that I will never forget was, "I will not leave you nor forsake you." Now, for someone of faith, I recognize that as a biblical verse, but it was more than that. It was a medical professional whom I knew would not leave me with, "There's nothing we can do, and I don't know." I knew at that appointment that he was going to help me, and I had a level of hope that I had not had before, and hope is a kind of medicine as well.
We have to let the patients chime in on what is best for them, and that because everyone has different preferences and values. So once we establish a good treatment plan and they're taking it and they're well controlled, then we monitor them.
In the midst of this chronic, devastating, life altering condition, I didn't realize it at the time, but those experiences and my working through that situation would eventually influence a major and very positive career change in my life. I decided to make a midlife career change into nursing. Just the care, the love, the attention, the dedication that I've seen over my own life with nurses and doctors, I really just felt called to give back and to serve.
Methi is doing quite well currently. She seems to be significantly improved with respect to her hives and in all overall good health. The big message is that hives are a chronic condition. They can be very burdensome to the patient, and there's a tortuous, long journey for many patients if they don't end up in places where physicians or other healthcare providers are aware of the diagnosis or how to diagnose it and how to manage it. So work is to be done, but we've made great strides in terms of treatment. Patient support and advocacy is extremely important. I think it's extremely important where patients can talk to other patients who have hives and have shared experiences, and also be able to find out where can I find help to control my hives, and reassurance, and that there are treatment options. So they're very important in helping any chronic disease.
The thing that I would say to people out there that are dealing with the condition is to persist, 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 persist. I'm just so thankful. I am so thankful. I feel like in many ways at 50, I'm just beginning my life. And so I just feel like there's so much to look forward to and so many things to experience. And I am in a 50-year-old body, but I have the excitement of a 25-year-old.